Hi, I'm Pam Dixon with the World Privacy Forum. Some people have asked, how can I possibly get all the copies of all of my health files that have been exchanged in a health information exchange organization? Because the idea is that your health information can be spread across multiple healthcare providers. Well, the truth is that some HIEs just simply have pointers to the files and your records haven't moved anywhere until you get treatment. So the general rule of thumb is this. Your first step is to always get your records from your healthcare provider directly. And then the second rule of thumb is, after you've done that, if you're really concerned about probable errors or maybe omissions or maybe forms of medical identity theft, then you take the next step and you inquire about how to get your records from the HIE if your healthcare provider participates in an HIE. Let's say they do. Let's say that your records are being held at a hospital that participates in an HIE. What you would do is you would go to them after you already have your healthcare files from them, and you say, you know what, I also want to find out if my files have been exchanged further afield through the HIE. And each HIE will probably give you a slightly different answer about how that works for them. There's no standard format for a health information exchange right now. They're all subtly different. Some will have exchanged your whole file. Some will have exchanged part of your file. Some may not have exchanged your file at all until you specifically allow it to happen. So there's a lot of varieties, and for this reason, the very best thing is for you to request a notice of the privacy policy, sometimes called an NPP, or just a notice of privacy practices for both your healthcare provider, and then ask if one exists for the HIE. And sometimes this will be the case. That's your very best shot at finding those records. We have an FAQ about something called an accounting of disclosures. An accounting of disclosures is a very thorough step you can take if you want to be sure to find out everywhere your healthcare file has been to some extent. And we'll talk about that more in a different video. Thank you.